I started using the CPAP in Las Vegas about 10 years ago. And the reason that I started using it was because I was falling asleep at traffic lights and bumping into cars in front of me. So I thought it was time to check on why I was so sleepy all the time. So that's where my CPAP started. I went to a pulmonologist, an expert in sleep, and I was put on CPAP, and it worked fine. So that was about 10 years ago. Now, over the last couple of years, I had gotten to where I had built up a resistance to the CPAP. I would guess that the muscles in my throat had begun to tighten and close up so that the CPAP was pushing against muscles that were tense. And because of that, I was not getting much sleep. It was progressive over a couple of years, and it finally got to where I wasn't getting much air at all. So that's when I heard about the oral device that Dr. Bryson was making. So I went to visit him, and we decided to try it. I didn't have anything to lose, so we ordered me one, and he installed it and properly adjusted it. And that was about 6 months ago. And since that time, I would have to say that my sleep is, I don't guess I don't sleep 100% of the time that I would like to sleep, but it's much, much improved. In fact, it's satisfactory. So I recommend this device to be used either with the CPAP as I've been using it. Now I use a full face coverage mask when I use the CPAP, and it's possible to use the device in my mouth at the same time and then cover with the mask. So I do use the two of them together at times, but at times I use just the oral device. And I would have to say that my sleep is satisfactory. I don't fall asleep at traffic lights, and I'm able to take care of business all the time. So I highly recommend it, either as a single device or as a device that can be used in combination with a CPAP machine. So for those who are anxious about giving up their CPAP machine, you wouldn't have to. But I might say that when you get the device and you try it, you may find that the device works fine by itself. Now, the way it works, just in relative layman terms, is that what the device does is it pushes your lower jaw forward when you relax to go to sleep, and by doing that, it brings the tongue forward with it, simply making the hole which you have to get air through larger. And by making the hole larger, then as you sleep, you don't close up. And I think what was happening with the CPAP machine by itself is over time, the muscles in my throat built up a resistance, and they were closing off, so I didn't get any air at all. So my sleep is certainly satisfactory now, much better than it was without the device, and I would highly recommend it for anyone. And for anybody who is worried about whether or not they can have this device and whether or not they can have this device without swallowing it, I can assure you that you cannot swallow this device. And I know that some people are very anxious about having anything in their mouth when they sleep. But after a few nights with it in there, I certainly got used to it, and I think anyone who used it would. So I could rate the device as excellent. My results with it have just been phenomenal. And I recommend it for anyone who is either has sleep apnea to begin with, or they're already using a CPAP machine, but it's not satisfactory. If your sleep is not satisfactory, I'd recommend you try this device. Dr. Bryson is an excellent technician. I just can't say enough of his ability. He's very kind and very patient, and does just a simply great job of putting this device in and making it work for you. My experience has been perfect. I really do appreciate the job that Renew Dental has done in fitting this device for me and following up and taking care of me.